Adequate notice of this meeting of the Atlantic County Board of Chosen Freeholders was provided in the following manner. Published in the Press of Atlantic City and mailed to the Current, the Daily Journal, the Hamilton Gazette, and the Hamilton News. It has been posted on the bulletin boards in the county office building in Atlantic City, the Stillwater building in Northfield, and the county clerk's office in Mays Landing. Okay, we'll open with an opening prayer. Almighty God, we pray for the strength and courage to work towards a nation and world of peace and understanding. Grant that our decisions be wise, our principles sound, and our performance in office faithful. Thank you. Can we all face the flag? Attention, salute.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty
and
justice for all.
Okay, can we have a roll call, please?
Ballas.
Here.
Bennett. Bertino.
Here.
Horsey.
Present.
Days.
Here.
Fitzpatrick.
Here.
Gatto.
Here.
Risley.
Here.
And Kern.
Here. Okay, freeholders had an opportunity to review the minutes from November 10th, 2020. I'll enter a motion to adopt the November 10, 2020 minutes as presented.
So moved.
Second.
A motion's been made in second. Can I have the roll call?
Ballas.
Yes.
Bennett. Bertino.
Yes.
Horsey. Horsey.
Yes.
Days.
Abstain.
Fitzpatrick.
Yes.
Gatto.
Yes.
Risley.
Yes.
And Kern.
Yes, motion carries. Okay, and just a word, as we always do these days, is anyone that would like to speak during the public comment, please type yes in the question and answer box. You'll be raised from an attendee to a panelist. When you're raised, please state your name and town you reside in. Okay, is Pat here? I see that she is, and we're going to look for an update from Pat.
Hi, thank you so much. Good evening.
Here, Pat.
Okay, since my last briefing, December 1, 2020, as of today, the cases, the cumulative Atlantic County-wide positive COVID-19 cases to date are 9,461, up from 7,722 weeks ago. There are 433 recoveries, and unfortunately 293 deaths have been reported. Daily updates to these numbers and cumulative numbers are posted on our website at aclink.org. We continue to see an increase in cases in the state and in our area. The risk level matrix in our southeast region, which consists of our county as well as Cumberland and Cape May, went from moderate risk to a high risk level last week. The entire state now is in the high risk level. In reviewing the three metrics that state health uses to determine a risk level in the southeast region, it was the increase in the number of cases that were occurring in our area, and not in the positivity rate or the percent of people presenting in the emergency rooms with COVID-like illnesses. Now, this warranted actually the change from moderate to high. So it was actually an increase in the cases that caused it. A meeting because of this was convened with the superintendents last Tuesday in anticipation of this change. Additional measures were outlined for them as to what needs to be put in place to reduce transmission during in-school education. In our county, similar to the rest of the state, we continue to see the increase in cases, not due to schools or businesses being open, but in transmission in the community within families and group gatherings. The state continues to provide contact tracers to be able to accommodate Atlantic County in investigating cases, and we are actually up to 50, with many of those contact tracers, case interviewers speaking Spanish. So that is good for our diverse population. Regarding testing, there continues to be more and more people seeking testing, and as a result, unfortunately, lab capacity is at a max, which results in a slower turnaround times. But as in the past, labs usually can, increase their capacities, and the turnaround time does decrease. We really direct people to get tested if they're experiencing symptoms, COVID-19 symptoms, or if they have been in close contact with someone who tests positive, or if their healthcare provider has referred them to get tested. Some people will say, I want to get tested for my peace of mind. Well, we keep educating individuals. For your peace of mind, you just need to practice social distancing, masking, making sure you're staying away from all people, making sure you're washing your hands, those types of things. So testing shouldn't really be relied on, just because of peace of mind. There's other things that really should be continued to be put in place. The New Jersey Travel Advisory now strongly discourages all non-essential interstate travel at this time beyond the immediate region of Connecticut, New York, Pennsylvania, and Delaware. Anyone venturing out beyond those states should self-quarantine for 14 days upon return. Our vaccination preparedness, we continue to prepare for vaccine distribution. Our goal is to vaccinate 70% of the population with our partners, hospitals, federal public health centers, pharmacies, and what have you. Vaccine will be distributed in a phased approach and will be scarce at first. Initially, doses will go to healthcare and essential workers, then individuals at high risk, followed by the general population. The division has submitted a vaccine location draft plan to the state as to the tentative locations for vaccination distribution. Most actually mirror the flu vaccination locations. And that's and actually our flu activity report, I'm pleased to report, is low. So we are not seeing an increase in flu activity in the county. So with that, that's my report. I can answer any questions or, entertain any comments.
Madam Chair.
Chair, you have to come off of mute.
Freeholder Risley.
Thank you. Question for Pat. How do the local hospitals look? Are they coping well? Or are they? Do you have any figures and supportive data on that?
Hey, the Southern Region Hospital Association meets at Cooper, but they virtually meet at Cooper, and they evaluate all the available beds in the Southern Region, ICU beds, those individuals on ventilators, and they are seeing an increase, but they are dealing with the increase. They are also, and it's important to keep in mind, patients are being discharged, so that does free up space. And they are looking at, further into the winter as far as how to increase an anticipated taxing on their beds. So they are networking with each other. But right now, they are able to handle the increase.
Thank you, Pat. I appreciate the comment. Thank you.
You're welcome.
Do I have any other freeholder comments or questions for Pat at this time?
Madam Chair?
Yeah, Madam Chair.
Freeholder Ballas?
Yes. Pat, just a quick question. We have a running total of 9461 cases so far since we started keeping count.
Yes.
And between the recoveries and deaths, that leaves us with about 4,800. Does that mean we have 48 active cases right now? Or?
Yeah, I'm glad you brought that up because I've always wanted to explain that. Many people don't want any calls back, or if we'll call them back to find out how they're doing, they'll just hang up, or they'll just say, I've got the information, don't call me back. So that's the number of people that really we are not able to reach for whatever reason. Sometimes we just lose them to follow up. They give us a phone number and it's not a right phone number. Or they'll say, I don't want you to be calling me back. This is it, I'm fine. And so therefore we can't really confirm, or deny whether or not that they have been cleared.
So there's no way to take them off the list as recovered after a certain amount of time.
Well, we may be able to, because right now we're looking at really educating the cases as far as what they need to do. And the state has allowed us to do this because of the increase in cases. So we educate them and say, okay, in 10 days, if we don't hear from you, if you get worse, you call your healthcare provider and you call us. But if we don't hear from you, we're going to consider you cleared. So there's no reason for a callback. So that's how we're managing those. And we've actually seen an uptick in those types of cases that have been cleared.
Okay, great. Yeah, because I know from the people I talk to, when they hear these numbers,
Yeah.
they think that there's 4,500 or more people walking around with COVID, and it's scary.
Yeah. No, but thank you for bringing that up. We'll have to perhaps craft something to address that if that's a concern out there.
Thank you.
Thank you, Freeholder. Do I have any other Freeholder questions or comments? Anything for Pat?
Madam Chair?
Yes, Freeholder Days?
Yeah, thank you. Thank you, Pat, for the update as always. I know that some school districts have had their school nurses trained in contact tracing. Is that being done in every district as a way to kind of alleviate some of the stress of the county contact tracers?
The schools actually are charged with contact tracing. That's actually within the Communicable Disease Service guidelines, that they know their population. They contact the parent or the staff person to work to determine who was a close contact. There are programs out there. There are some districts, some school nurses will elect to go through John Hopkins or Rutgers programs, but really they can learn on the job. And they are contact tracers that we have onboarded, and there's 50, and most of them work remotely. They've gone through some basic education. They shadow our staff remotely and in-house to learn it better. So that constant communication during this period of time between contact tracers, our staff, and the school have really improved the skills of the schools to identify close contacts quickly. The school's communication is really, it's an ongoing thing with the schools every day, 7 days a week.
Great, thank you.
You're welcome.
Okay, thank you, Freeholder. Thank you, Pat. Do we have any other comments? Freeholder Begato?
Thank you, Madam Chair. Hi, Pat. Just a couple questions. Maybe you could just reiterate, because I've gotten the question more frequently again lately, just in terms of the contact tracing process. On average, how many days after a positive test result can people expect to hear from us for contact tracing?
Well, it depends on the volume of cases, okay? And the reason why we're getting more contact tracers on, and that's occurring really throughout the state, is to deal with the increase in cases. So we like to say within, say, 24 to 48 hours upon the result being submitted into the electronic system. And we're reaching that more and more because of the increase in contact tracers, but also it's the way that the state has pivoted in handling the number of cases. So we investigate the case, we call the case, we educate the case, we explain to them if they get worse what to do, we tell them to call us or the healthcare provider if they should change, and then we move on to the next case. And we ask them about their contact tracers, but we really put it on the case to educate their household members as far as how to quarantine. We educate the case on how to educate their close contacts as far as how to quarantine. But if those close contacts are at high risk, then we do follow up on that contact. And what that does is we're concentrating more on the cases and less on those contacts, and we're putting on the case to do that. So that's alleviating, that's giving us the ability to get to the cases quicker.
Okay. I'm sorry, go ahead.
It was just really, and it really happened throughout the state. And then everybody was onboarding contact tracers in anticipation of the winter months, but because of the acceleration, there was just no way that, that turnaround time could be adhered to. But we continue to work on that. And some people don't really even want to have us call them, actually. So go ahead. I'm sorry.
Yeah, I've heard that as well. The other question I have, or I guess it's kind of like a myth out there, Pat, hopefully you can dispel, is that people need to continue getting tested until they get a negative result. Are we requiring that, or is it you get a positive and then you follow the CDC guidelines of quarantining for 14 days or a certain number of days after the end of symptoms? Can you just clarify that?
Sure. If you get a positive test, okay, and you don't have any symptoms, then you isolate, they call it, for 10 days from that positive test, okay? Because you may be asymptomatic, you may continue to be asymptomatic, and of course about 25% actually are, but it gives about 10 days where you would be infectious, and therefore you have to isolate. You don't want to transmit it, okay? If you're symptomatic, okay, and you get tested 3 days after your symptoms begin, okay, your isolation starts at the time that your symptoms started, okay? So it's either positive isolation or symptomatic isolation, depending on when the positive test result was without symptoms or when you began symptoms with a positive test result afterwards. They used to say, to release yourself from isolation, you needed a negative test, or a negative test was thought to be a clearance. However, it's not, because they have seen through studies that up to 3 months after you test positive, you could be shedding a virus that appears in a test. So you're not considered infectious after the 10 days. So it's not necessary to get a test. And we do come across this with employers sometimes, requiring employees to get a negative test to come back, even though their 10-day isolation period is ended. And we educate them, no, that has not been the case for a while. And we actually have a document from the state that I can share if you'd like, where that outlines that, how formerly it was thought to be something that was necessary, but now it's not, because of this research and studies that they know that that virus will shed from that individual for a while, or can shed, but it's not infectious. It just shows up.
Okay. Thank you so much, Pat.
Thank you. Do I have any other freeholder comments, questions for Pat? Okay, seeing none, Pat, once again, thank you and your staff for all your.
Chairwoman,
Oh,
Chair, we have some public questions.
okay.
Mr. Creed Pogue is being raised from an attendee to a panelist. And once he is raised, which he is, he can ask his question. Mr. Pogue, go ahead. Mr. Pogue, you may ask your question.
We can hear you, Mr. Pogue. So, I mean.
You can hear me?
Yes, now we can. Go right ahead.
Oh, I'm sorry. Okay. I thought I was messed up on my microphone and everything. Okay.
Oh, you're fine. You can go ahead, Mr. Pogue.
All right. I had two questions for Pat, if that was possible. One, right now testing is set up for December 8th. Is there going to be testing after December 8th? Where do things look as though they're going to be going into the new year? And is any of that a federal funding issue with CARES Act, COVID relief, et cetera?
We received funding to continue testing, but we partnered with Atlantic Care to offer testing. The drive-through site, as far as itself, and for the 8th, however, to continue that, the plan is to continue as long as weather permits. So that's what we're looking at. And many of the drive-through sites throughout the state are looking at that as well, as bringing things inside.
Oh, okay. All right, so it's a weather. We'll see. Yeah. We'll see what the winter looks like. Okay.
Yes. Yeah. It gets cold in there.
Yes, I can sympathize with that. I've been there a few times. So yeah. The other question is, and I guess in part to follow up on Freeholder Ballas's question, do you have any data as far as how many of what we're calling recovered are also dealing with long-term complications? I think we've all unfortunately seen at least some people who have, dramatically reduced lung capacity or things like that. I know of a church friend, her brother-in-law had worked as a nurse, but now he's no longer able to walk the floor after his bout with COVID. And I just didn't know if we had any local information on how many people are in that particular situation.
No, not at this time. We know that there appears to be residual from those people with COVID-19 cases. Some completely, are clear, but some have residual. Locally, I don't have information as to that. As we increase, though, the information within the ComCare software that collects all the data on individuals, perhaps we may be able to cull information out of that. But no, I do not. I do not have anything specific to report.
Yeah, it's just that's the most maddening thing for me, for people who try to compare this to the flu.
Well, you really can't compare.
I know.
Okay, please don't do that, but get your flu shot.
I already did.
Okay.
Yeah.
Okay, good.
Thank you.
You're welcome.
Okay, thank you, Mr. Pogue. We have somebody else from the public, Madam Clerk?
Yes, Chairwoman, we have Mary W. We are going to raise her to panelists. Can you hear us, Mary? Oh, I'm sorry. Okay. I'm sorry, I'm moving too fast. We had to take Mr. Pogue off first. And now, Mary, can you hear us?
Yes, I can. Can you hear me?
Okay, you can, yes, you can ask your question.
Wonderful. Thank you. My name is Mary Winkleman, and I'm in Atlantic County in EHT. And my question is for Pat. Thank you for the updates. I wanted to know, within the positive case count, is there a breakdown that the public can see that is long-term care facility residents as part of those positive cases for the county? And then, okay, go ahead.
The long-term care residents, that's actually appears on the New Jersey COVID dashboard. That'll have an outline of each county and the long-term care facilities within each county, the number of residents and number of states that are positive. So that's where that's located.
Is it part of the positive case count that you just spoke of?
Yes, it is. The positive case count that I refer to is a accumulation of cases, both PCR tests and antigen tests that were positive in the county.
Okay, so you are including antigen tests as well?
Yes, yes.
Okay. And then my second question is it public knowledge or somewhere we can find what lab is responsible for the test results and how many cycles, threshold cycles, I believe, is it that they are run through to get the results of a positive or negative?
That's pretty much a technical lab question.
Mm-hmm.
The State Department of Health Bureau of Laboratories. I know they try to handle the large capacity of tests by running 4 samples at a time, and if they're all negative, 4 are negative, and say if 1 is positive, then they need to reanalyze the 4 that they ran. But that does increase the turnaround time. However, with the number of people being tested overall, the capacity is just increased. But that is a lab question that you could probably forward up to the State Department of Health on.
Okay.
Okay.
Thank you.
You're welcome.
Thank you, Mary. Do you have any other questions?
No, that was it. She was answered my questions, and I will move forward with going to the state. Thank you.
Okay, thank you very much, Mary, for being here.
Thank you.
Do we have any other further comments from the public?
Mr. Pogue just added, and I don't believe he wants to come on. My last test was bioreference.
Yeah. It's a laboratory that we have utilized, other counties utilize, hospital use. It's a good lab. It's one of several out there.
Okay. Do we have any further comments from the public?
No, that's it, Chairwoman.
Okay. Once again, thank you so much, Pat, for you and your staff and all your hard work and hours that you're putting in for our entire community here. Thank you.
Okay.
Okay, so at this time, in line with our COVID updates and regulations, I'd like to address a letter of a complaint that we've all received copies of. And it's to do with conditions at the Atlantic County building in Atlantic City. They're very serious allegations from our employees who we care very much about the safety of them and their families. So, I'm going to ask Jerry for full transparency to address these complaints. And I believe you also may have Forrest Gilmore there with you, so we can get the answers from him. So whatever.
Yes, I think we sent you the complaint. The compliance officer is Mr. Boast, Pat Boast. So, briefly, so they received 3 complaints. So the first one was no temperature checks at the door for workers or public. And so I think I've shared the letter with you. So briefly, if you read the Executive Order 192, it gives you 2 options: take the temperatures, or you use a health screening. what we've done is we have, and if you've gone through all of the attachments, the first attachment is 61 pages of all our policies, and they're in line with the state executive order, any of the state policies, state health policies, and the CDC guidelines. So we've selected the health screening. And so basically, it's the same thing we do with the flu season every year, and what we tell employees, regardless of the virus that we're presently in, the pandemic that we're going through. They should all check themselves before they come to work. You have a copy, I believe, of the questionnaire. It's in that packet. So I do need to tell you that I went through almost 45 minutes today with the Department of Health, State Department of Health, and the PO's portion of that. So the question asked of me is well, what do you expect employees to do? Well, the first thing is to look at, we've asked every employee to take it home. If they have, in this particular case, and he asked me why wouldn't you take temperatures? He says, because here's a perfect example. I wake up in the morning, I might feel some chills, I might be a little achy, I might have a headache. That's 3. I only need 2 in that section. And you may not think too much about it. You come to work, I take your fever, you don't have any fever, and you still go to work. So we're not sure that having a fever or not having a fever, and Pat is on, and she was not on today when we've had some of these questions. Pat can address that from the public health side. So we've elected to tell employees we'd like them to check themselves every day. Now, when they're at work, I was asked a question from POs, what are they supposed to do? If they begin to feel sick at work, the first thing we've told them in our policies, they're supposed to go to their manager immediately, and the manager will handle it from there. If they meet the conditions, they will be sent home, told to go talk to their doctor about what it is they should or shouldn't do to take that step further. So that's the decision that we've made there. The other issue about public coming into the building, there are limited people that come into the building. And if you go through the package, you'll see, and I've let, at some point, you probably have questions for Forrest. You'll see that there's a group of people that may be coming into the building, and I want to make sure you hear this. They've lost their electronic benefits card, their EBT. They may need to have a Medicaid verification, and they would be dropping off documents. The preponderance of people coming into the building are going to be people dropping off their documents, which means they're not having any contact with anybody other than this. They come in, they have to wear a mask. There are signage outside the building. They must wear a mask. They would come in, they would be with security. They would go to where the drop box is, they drop it off, and then they would leave the building. I mean, so I'm not sure why we would have to take their temperatures, because there'd be no contact with any staff at all. And they would not meet the conditions, under the guidelines now of what a close contact is. And again, Pat, I know what the definition is. I'm not a health expert. I've listened to it 1,000 times. I can tell you 15 minutes in a 24-hour period. Patty can confirm that. Patty can talk to that. With that said, we don't believe we needed to take temperatures. That was the first issue. They're saying we're not sanitizing the building. So I think we got to ask that question. Building is cleaned every day. We've given POs the list of chemicals that are being used. All the high-touch areas are being cleaned during the day. Bathrooms are being cleaned at least twice a day. And so we did a deep cleaning of the building in April time period. We've cleaned again, deep cleaning now I'm talking about, in November, and we're starting again in December. I'm not sure exactly what they say is not sanitized in the building. With respect to their own desk and area of influence that they have among themselves, everybody was given, and that was one of the issues, no PPE. They were all given a mask. Every single employee was given a mask, and every employee was given these handy wipes. In our policy, they're told every single night before they leave, you clean your phone, you clean your desk, you clean your computer. If you have printers, you clean your printers, any of the touch areas in your room. So they're given those sanitary wipes to do that. And if you don't have any, you can go to your managers. And in this case, I can tell you, the people responsible within Forest Shop are Bertie Cody, Miss Cody, and she's here with Forest tonight, and Cindy Smith. Cindy is our assistant business manager for the organization. So the next issue was poor air circulation. Now Jerry's on. Jerry can probably go through some of these, but so let's be, we'll be quick about this. So we used to do changing the filters every 6 months. It's now every 3 months, and we do preventative maintenance every 3 months. There's a list. I believe it's in this package. So we've stepped up the air circulation. They've increased the air circulation into the building. So, for example, if you came into this building, there used to be exchanges, I think, every 15 minutes with the outside. They've now opened that up. So whatever the cubic footage was, it's now expanded. So there's more air being exchanged on a more regular basis. They say there are no barriers between customers and employees. So we went out and took roughly 30 pictures of the areas. So let me give you the history. During the period from March through June 15th, for the most part, we were on flex schedules. The entire state was on flex schedules. We were all given the notice from civil service that we could do X, Y, and Z. County elected to do flex schedules, which most counties did. That meant people were working maybe 1 week, off 1 week. Maybe they were working 2.5 days and they were off 2.5 days. But we knew come June 15th, we were coming back. So Diana Rattel, who's our deputy administrator, Liz Dancona, who's our human resource director, Miss Cody, who's here, and Ms. Smith, went through their entire office space. There are 1, 2, 3, 4, 6 in our building, those floors. They went through each area. They measured off every single area where an employee had to sit to work. Where they could not accommodate the 6 to 8 feet, we then took our conference center and we measured off the conference center. So we took conference rooms, out of our conference center, and we now have, a office space where they have desks with glass enclosures. And if you look in your package, you'll see, the glass enclosures. In addition to the glass enclosures for the office staff, there are cubicles that were set up with glass enclosures for interviews. So if Jerry DeRosso showed up and he called and said, I lost my tape, I need to get my Medicaid verified and certified, there are spaces where they can bring the client in. Number one, they all have to be masked, and then they would be brought to this area where there's strictly glass enclosed. There's no physical contact between an employee and or the client in order to perform whatever services is required. There's this discussion about, and I want to one more time on PPE. If you go through the actual response, you'll see that everybody signed for their mask, and there were other issues that were given to them. The sanitary wipes. You'll see that every single employee signed for the mask. So I'm not quite sure what they're talking about in terms of not getting the PPE. and I'll let Forrest and Miss Cody talk to that if there are other issues that they've been asking for that we haven't accommodated. But I don't believe there is. They're talking about the public, using the bathroom. So if a public person, so let me be clear on this one. There are individuals that come into this building who, as you know, we have a thing called TANF, Temporary Assistance for Needy Families. And there are also individuals who are older that have a child only case that are probably older. They're probably grandparents. So the question is you have a pregnant woman, who's in the building, and you might have an older person. Forget younger people. I'm just going to give you some examples. So if they have to go to the bathroom, where do they go? Well, there is a space next to where the front desk is that they allow them to go in there. There are 2 separate bathrooms. Nobody else uses the bathrooms. But what's disingenuous about this complaint is that on the first 3 floors of the building, there are private bathrooms for employees. You can only get into them, they're locked, they're keypadded, which means, only employees have the numbering system in order to access those bathrooms. And the bathrooms, as I said, are cleaned, at least twice a day. Those bathrooms are cleaned on an as-needed basis, and security obviously is the one who works with our cleaning crew in order to make sure that those bathrooms are cleaned appropriately. And then the last, in terms of the complaints from that POs received, is this whole issue of reporting the positives that would occur within and the union wants us to report those positive cases to them, not necessarily the names, but that there actually were positive cases. We've always relied on him, and again, Patty's on. So I mean, if I'm speaking out of turn, Patty can correct me. Our policy has always been that if somebody is tested positive, again, it goes into a system called the CDRSS system. Patty can explain that to you. That person is automatically called. And you all have asked the question, Patty, how long does it take you, to reach out to those people? In the meantime, the contacts, and I'm only talking about in the best of situations. You've heard Patty say that the cases are escalating. But in the meantime, the person who is sick is out. They're isolated. If there are exposures, typically they would be called and they would be told that they have to quarantine. We're not calling the union because the people are out. They've been told to stay out. Now, POs called me and said, well, what would you do if somebody called you and said they were positive? I said, well, I got to be very honest with you. It would be absolutely ridiculous for somebody to call me and tell me they were positive unless they worked in our office. They really have other contacts without having to call the county administrator. But I said, but here is a perfect example. Friday night, I get a call from somebody who says, my husband was around a person who's been tested positive. My husband decided to quarantine himself. And so they asked me, what should they do? And I said, well, I got to be very honest with you. I'm not a health professional. I mean, I can certainly give you advice. I'm not going to do that. I will make sure that public health calls you, your husband, and advises you correctly. And that's what happened. Now, if that person didn't call me, I would never know about it. If that person was called and told by public health to come to work, they would come to work. If they were told to quarantine, they would quarantine. How I might find out is that they don't show up to work, and they call out sick. And at some point in time, they're going to be out a prolonged period of time if they're quarantining or isolating, and they would have to report that in some way to personnel, because there would have to be a means of getting them back to work. And there is a process that we follow. So I'm not sure why we would ever have to notify the union and why they think we have to notify them when there is this whole contact tracing process in place. And it has been functioning. I mean, I've asked, are there cases going, slipping through where, people are not showing up to work? We don't know why they're not coming to work. That from what we understand, that is not happening. Everybody is understanding that if they're positive, they are taking the appropriate action and if they're isolating, and anybody who has been exposed and public health tells them to quarantine, they've been quarantining themselves. So that I think is the essence of the letter that I wrote and the questions that, or the complaints that we received. However, one of the things, and I want to turn this over to Forrest, one of the things that is, is of concern is the fact that Forrest and Bert walk around the facility all the time to ensure that people have masks, They have, the appropriate PPE. They have the appropriate hand sanitizers that they're getting. If you understand the policy, and the policy is also in the executive order, that we give time to people to go ahead and wash their hands occasionally so they can do that. So they're walking around the facility. At no point in time did anybody ever say to them, "Oh, by the way, we have these complaints." And so if you're okay with that, Madam Chair, I'd like to, as far as, to kind of go through some of the things that they've been doing so everybody understands these complaints are, look, and everybody can complain. We will answer them. We will address them. But not to deal with the people that are going to have to deal with this on a regular basis just seems to me a little bit disingenuous. So if you would, give us the opportunity, I have Forrest here. You're you're on mute.
Yeah, would you let everybody know Forrest's title as well?
Sure. Forrest is the department head for our Department of Family and Community Development, and they run the what were considered the welfare programs, and he deals with the homeless population on a regular basis. And it is his department that works with the single point of entry, which is in our building for homeless individuals. Forrest. Okay.
Good evening, Commissioners.
Good evening, Forrest. Thank you for being here.
My pleasure.
Do you want to make statements, or you want to ask people ask you questions, or did you want to make a statement on these allegations?
Well, the first thing I would like to make a statement. Since the pandemic hit, the primary reasons and the primary actions of all of our managers in here, Bertie, Cody, Cindy, is the protection of our staff, adamant about what we call limited customer contact. The goal is to limit our staff's contact with our customers. And in doing that, we have what we call telephone interviews for all programs, even programs that require face-to-face. We have petitioned the state, and they granted us to do telephone interviews for programs that regulatorily are called for face-to-face interviews. But because of this pandemic, we actually put in a case that we can provide this by telephone contact. So therefore, all of our basic interviews, and I'll give you a number. I'll pass that down, Bertie, that piece. I have the numbers here. Since the pandemic hit, we've conducted close to 13,000 telephone interviews where we do it over the phone. However, there is limited contact. If a person, we deal with the very vulnerable. I'm adamant about this. I'll give you an example. A blind individual came in the other day. We secluded him over onto the side where people sit, 6 foot distance. This gentleman, he couldn't fill out an application. He could not go online to do an application. So we will have limited contact. And to compensate for that, we have invested in what we call interview booths. These interview booths are set up away from, they're not back in what I call the main areas. They're off where we used to have waiting areas. We took all of those waiting seats out and built these individual booths because we understand at some point, some of the people that we deal with are vulnerable and they're going to need assistance in either an application, because as you know, going online, you need that particular kind of equipment. Everybody doesn't have it. But if they need SNAP, the former food stamp program, or any other service, we have to be in a position to provide that. I call them customers, constituents, the people in need, to ensure that they get the benefit that they're entitled for. And I take that very seriously. And when this pandemic hit, it was certain people here. I was here every day. Every day we were here. And I understand people were out, and that's their prerogative. We were here because the services we provide here in Atlantic County, and we get the support, our staff get the support we need, is to provide the services to the most vulnerable population. We have 20,000 people on SNAP. We have maybe equivalent to that on Medicaid. And that's not to even talk about the general assistance population. That's GA and the TANF, mothers with children, the homeless. Not everyone has the capability of sitting down on a computer. Not anymore. The libraries are closed, places closed. So when they come in, I can't muster up, tell them, we can't see you. Put a mask on, do a limited interview. We've made substantial investments in these booths. We've took out all waiting areas. One of the things, there isn't going to be any more waiting rooms where 15, 20 people, 30 people can stand around and wait. We're trying to get to an appointment basis only, similar to what they do at the doctor's office. You call, you go, you wait in your car, but we can't tell people to wait in cars because some of them don't have cars. So and when people access our building, it's because it's almost an immediate need. And in fact, that's a law. Immediate need, we have to respond to immediate need within 7 days. So we can't tell people to go away and come back. But one of the things we can do is ask our staff to have limited contact when they have to. They have to engage with people. Social services is an engagement profession, but we can limit that particular engagement, do it quickly, get the information, wear a mask, wash your hands. If you get sick, don't come in. And we're pretty liberal with that. And I just feel, I feel personally, I don't know, it was an insult to me. Personally, I feel that, but I know that personal feelings don't mean anything. But that's the steps we've taken in this particular 1333. And like Jerry said, we got pictures, and we're still in the process. I requested from the state to have allocations for funding because of this. We were successful. We're building things. We're still in the process of modifications to our staff. We've vacated rooms, put the proper equipment and cubicles in it, and we had the best to do it. Barry Goff. It wasn't something that we came up, well, I think we should do this. No, we had a bona fide consultant come in, Barry Goff. He does it for the courts, the city of Atlanta. He said, we would say, we would like this, but he said, you should do it this way because you're in compliance. So that's the kind of organization we're moving to. As with respect to working at home, I do not disagree with it. However, I'm not comfortable with it because I don't know how to manage it. With casework and files and confidentiality that would have to be probably removed out of this building, social security numbers, birth certificates, we're working on it now. We're working on a system and a model. If they actually orders come down and say, close down everything. But the services we provide can never stop. They can never stop. Because if they stop, you're talking about chaos. Revenue is to the people that we provide benefits to. Revenue is an EBT card, a food stamp card, a TANF card, a WIC card. That's what they have. That's what they survive on. And if the unemployment is not continued or whatever, we have a challenge in front of us. We have, like I'll reiterate, 20,000 people. We have certain programs that we're required to do face-to-face. We've gotten approval not to do that. So we want to continue in that line. So we have limited customer contact. And
I totally appreciate your passion and you, especially you being here this evening, because as you know, it is some very severe and complaints that we received, and we felt it was important, that the freeholders have the opportunity to ask some questions. So we don't prolong everything. We understand that. I am going to go to the freeholders right now, if that's okay with you. to see what, thank you.
You're
So see
welcome.
what kind of questions we may have. And I've got quite a few hands here. I'm going to go to Freeholder Fitzpatrick.
Thank you, Chairwoman. My question is actually for Jerry. Do we have he's there, right? Yes?
Yeah, he should be.
He just went off. My question is this.
Back.
Hi, Jerry. You're muted. My question is this. Do we have a schedule going forward for deep cleanings? Are they going to be done monthly, quarterly? Can you tell us?
Probably monthly. Right now, the month of this, we did November. We're now doing December. I think the first for 1333 is this Friday.
And so how many cleanings will $85,000 buy us?
Well, it depends on the building. I probably say, 6, depending on the building. But again, I want to be clear on this. Right now, we have X number of dollars that we're trying to use. Come in the new year, we'll have a new budget. So what you're seeing right now is ending with the CARES dollars that we presently have. So.
Okay. And this is just a housekeeping thing. The third paragraph of this resolution has a little copy paste issue in it. It talks about ballots.
I'm not sure which one you're looking at.
Number 615 in our packet. Well, let me find it.
Okay.
You see it?
You're talking about the executive order 2021?
No, Jerry. The resolution in our packet for today.
Oh, today. I'm sorry. Oh, okay. I'm sorry.
That's okay. It says, it's the third paragraph down. It mentions ballots. It's a copy paste thing. That should, before we vote on that, I thought we should make that correction.
Again, Freeholder, I'm sorry. Which resolution are we talking about?
Resolution number 615 that talks about the deep cleaning.
Yes, okay.
It says, whereas the county requested quotes from 5 vendors using prior experience with printing and mailing ballots.
That's why I'm looking. That's why I'm asking. My 615 Freeholder is emergency contract with various vendors for deep cleaning, so deep sanitizing of county buildings due to COVID-19, amount not to exceed 85,000. Mine doesn't have that. I'm not. That's why I'm asking you.
Not on the agenda.
It's on the resolution itself.
Yeah.
I don't have the resolution.
Okay.
I don't have the resolution. I don't have the resolutions with me. I use just summaries and yeah.
Okay.
Okay.
Thank you for noting that, though.
Okay, great. Okay.
That was my question. Thank you.
Thank you. I have other freeholders that have any questions.
Madam Chair.
Yes, please, Freeholder Corsi.
First of all, let me just say, Jerry, thank you so much for the information and for full disclosure. One of the reasons the county had received a notification from the union, a couple union members had notified me or contacted me about some conditions in the county buildings, and I told them straight up, in order for this issue to be addressed, it should be put in writing, sent to the county administrator, and CC all members of the Board of Chosen Freeholders. So if in fact there were some issues and concerns that need to be addressed, all of us would be on the same exact page going forward to find out if in fact these allegations were accurate. And so I am told once a letter went out, there was some movement in the county building regarding cleaning. A company I'm told is coming in tomorrow. I briefly talked about this morning in the budget meeting. Jerry had made it very clear what was going on, how things were going to be handled going forward. And I know that there's some concerns of members who work in the county, but I thought it was important that they put it in writing and send it to the necessary authorities. This issue is a real serious issue, and some folks may not take it as serious as others. This pandemic is killing people. And if people have concerns, we need to make sure they're addressed, and we need to make sure they're addressed properly. And I'm not saying all the allegations that they're making is accurate, but if it comes to our attention as elected officials, we need to make sure that the proper authority is aware of it and is being addressed. You can't ask for no more than that if it's being addressed. I'm like Jerry said this morning in the budget meeting, if people are asking who are the people who are being tested positive, well, that's a HIPAA. You're not entitled to give that type of information out. That should be understood across the board, especially any union would know that. And I support the administration 100% not to give out names of employees if they came back tested positive. But I think it is important if they work in close proximity to someone who's tested positive. Here in the city of Atlantic City, if you're in the office, you test positive and you're in close proximity, we send those people out to be tested. Either that or we close the office down for caution purposes. So, like I said, full disclosure, when I was notified, I asked that they put it in writing and send it directly to the county administrator. Apparently they did so. For whatever reason or where we go from here, I hope these issues are addressed in a fashionable and expedient way. And it sounds to me that some of these issues, Jerry, are being addressed immediately. And I would hope that the union would get copies of what you have sent out in terms of what steps you have taken. But I do not support giving anybody's names who have come up positive if they have been tested for the virus. But let me caution all my colleagues that it may not be you today, but it could be you tomorrow, and you would want the same information and you would want the same courtesy. For example, I called Jerry over the weekend and I felt bad. Called Jerry over the weekend because a family member worked in one of the casinos. Young lady came from New York. She had tested positive. She told the people when she checked in, she tested positive. She went in and checked into a room. That night, they rushed her to the emergency room. Weekend, no one to call. I called Jerry. Jerry got right on it, had people from the county health department called. I called as far as up to the governor to find out what are the steps to be taken inside a casino, because the city of Atlantic City does not regulate inside the casinos. And so if those employees there had some concerns, they need to know steps were being taken, which for full disclosure, DGE oversees those casinos. So nobody answered the phone or those two numbers that we had over the weekend, but Jerry was able to get the health department to call, spoke to the young lady, spoke to a couple other people, and we heard no more about it, but they felt more comfortable because somebody got back to them and let them know that it was not being ignored and that it was being addressed. So going forward, I think it's the same issue here in the county. If there's some concerns regarding employees, I think that the administration will have to do their due diligence in terms of making sure the information is properly put out there. And we can leave the egos at the door, attitudes at the door on both sides of the aisle, but safety is going to be all of our number one concern. But I thought Jerry, to his credit, had handled it very well to this point. And let me just reiterate once again, I do not support giving out anybody's name that has tested positive for the virus. I think people around them should be notified if that's the case, but nobody should be given that type of information. And with that, Madam Chair, I don't want to delay the meeting. It looks like it's going to be long anyway, but I just wanted to put that out there for full disclosure. That's reason why Jerry then received a letter, because I was approached by some members of the union as well as county employees, and I told them what they needed to do because I did not have the answers, and it should have been something that came from the administration.
Thank you, Freeholder. So, what I just want to say is every freeholder has said their concern with these allegations that came forward. That's why we felt it was important to bring it out and have it discussed and know what's going on. We all care about the employees of Atlantic County, and as well as their families. I mean, these are people that are going home. They have families that they need to support. So that's why we brought it out. And I thank everyone for being here. Jerry, thank you, for having Forrest here as well. But are there any other further Freeholder comments in this regard? Freeholder Bennett.
Thank you, Madam Chair. Just really quickly, I wanted to certainly thank our county administrator and thank Mr. Gilmore. As a person who works in social services, I can certainly understand that these services don't stop. But I do have a question in terms of the county building. Is there a separate entrance for our employees and the public? And is there any way that we could put a temperature check-in for employees?
Is that it? Can you hear me?
Yes.
Okay. So the first that first question you asked, Freeholder, was asked by Pioche, and yes, we have two entrances in the building. We have the Backrack Boulevard and we have Atlantic Avenue. To my understanding, all employees should be going through the back. Some of them probably come through the front when it's early, but only clients can come through the front door. That's it. They cannot come through Backrack Boulevard. No one will let them in. They're told to go around to the front. So that's that issue. With respect to temperature, one of the issues that we're really waiting for is the state, quite truthfully, was going to give all the counties for getting, you got the executive order. That was the issue. But they were going to really kind of, I guess, give us direct responsibility for taking temperatures. They haven't done that. And the reason why is because you heard Patty, and Patty's on and she should jump in. You heard like 25% or people are asymptomatic anyway. Yeah, you're not going to get that. So Patty, you want to address that kind of issue?
Right, 25% of people that are actually test positive don't experience any symptoms. So as far as the self-assessments, the questionnaire, it's really a person's responsibility to kind of assess their own health. Nobody knows that's better than they do. A person may have chills, may feel feverish, but never really register a temperature. So it really gets to be subjective. Regarding CDC guidelines, State Department of Health guidelines, it's an option. It's a symptom. A self-assessment is really something that you really need a person to do. You wake up one morning, you don't feel right. You can't quite put your finger on it. Well, that's something that you really have to assess those symptoms. Others, you understand, I have allergies, I have whatever, congestion, I can explain it. So it's really, you count on that individual to know themselves. And if there's a change, then to report it accordingly. And looking at any symptom checks, as far as the temperature, the only thing as far as that I have come across that where it's required is in fact, you've got a critical infrastructure employee that needs to be at work. That has been exposed to a positive case, so they are under quarantine, like say a police officer or a fireman or what have you, that they report to work, they're quarantined, then it's up to the employer to monitor for temperature. That's the only place where I have seen that, and that's because that person has been exposed. In the case of our employees, if they were exposed, they would be in quarantine, they wouldn't be at work. So that helps.
Yeah, thank you, Pat. And
Thank you.
I just want to
Freeholder, I just one other thing, Freeholder Bennett. So while I was here, while it doesn't deal directly with the two questions you had, it does deal with what the union was exposed to. Forrest, he's here. He just wrote down quickly when you were asking those questions. They actually, Miss Cody and Miss Smith actually toured with the union leadership while they were making all the changes. So in other words, we made the changes not only with their knowledge, they actually walked around. I mean, at any point in time, they could have said, hey, would you do this or could you have done that? I mean, they actually got that kind of exposure. So again, I don't know what to say.
And Jerry, I just have to jump in. When we have positive cases and we call, employers, and we're looking for close contacts within that 6 feet for now greater than 15 minutes cumulative over a 24-hour period while the person's infectious. And we hear, that the employer, no, we social distance. We have built offices, we have built cubicles, and they are 6 feet apart. We provide the masks, we do regular cleaning, but really it is so comforting to know that it is really hitting home with employers and schools to do this. That's why we're not seeing, a lot of transmission in these places, because they're adhering to that. Those ever so important social distancing guidelines. And I just wanted to comment on that because it really makes it easier on my contact tracers and my staff when they make that call and they're adhering to that, because that's less contact tracing, that's less work devoted to that. We can get on to the cases. And I just wanted to give my 2 cents. That's all for my staff.
Thank you, Pat. Jerry, I'm sorry.
Real quick, Madam Chair. So I just thank you so much, Pat, for clarifying that. And thank you, Jerry, for addressing the temperatures. I personally have probably more contact with the public than some of the people in your building working in the hospital. And once we come in our physicians, along with doctors, nurses, and what have you, we automatically have to get our temperature checked. But I guess that is because we have in contact. So thank you for addressing that.
Thank you, Freeholder.
I got just Freeholder. It's great good that you said that, because I got to ask that question. So somebody said to me, well, I'll go to the doctor's office. I get my temperature taken all the time. I said, yeah, but here's the distinction. You go to the doctor's office. Let's be clear. You're going in there. You may have to sit down for a while in a room, because I did. You don't go in right away. So there's the potential for exposure there. Then you're going to be with a doctor for, and again, depending on what it is you're there for, you could be there a prolonged period of time. So I can see taking temperatures there. Most of what they're doing here is person coming in, dropping off whatever they need to drop off. Now, the case in point that Forrest made was he had a gentleman who was visually impaired. So there's a little bit longer time. However, he had to have a mask on. The staff had the mask on, and they were in a glass enclosed area, as opposed to, I'm assuming in the hospital setting, you're not necessarily sitting behind a glass. It's a little bit more exposure there. So again,
Thank you. And I just want to make mention of Mr. Gilmore and his staff. Love his passion, appreciate his passion. I want to thank him very much for his concern for our staff as well, and the people that he works with every day. Thank you so much, Forrest, and your staff. We know you're working hard. Thank you.
Madam Chair.
Freeholder Corsi.
If I may, let me go back to Jerry for a minute. Either Jerry or Pat can answer the question. I'm under the impression, Jerry, that the county was in the process of buying or purchasing the thermal scans. The city of Atlantic City, we purchased about 8 of them. We're still working out some of the blends in it, but I was under the understanding that the county was also going to be doing the same thing. Is that any accuracy to that?
No, those scans, we didn't particularly like those scans. No, we weren't going to do the scans. What they were really, I'm going to be very honest with you, the scans themselves, the reason why they were trying to sell us the scans was because it does more than just take your temperature.
Right.
Actually, it tells you who's in the building, what time they're in the building. And right. We already have all those systems. It actually, if you remember, it actually coordinates with your personnel files. We already had that. I mean, so we'd have been spending, and they're very expensive. In order to take temperatures, we would have been spending a lot of money just to take temperatures, when that system is very, very powerful and has a lot of other modules and functions. We didn't need those other functions. So that's the reason why we didn't do that. And there is some confusion about, the library. Again, the library is I don't know if you've been to any of our libraries, they're extremely safe. If you go there and you'll see they have all the glass partitions, they have all the seating, separated. People can only be in there 1 hour. So again, most of our locations, we believe, have met all the conditions of the executive order 192.
Thank you, Jerry.
Thank you, Jerry. Okay, and thank you, Pat, and thank you once again to Mr. Gilmore and his staff. Thank you so much for all the clarification this evening. If we have any further questions, we'll just forward them, through Jerry at this time. Thank you. Okay, so now into our agenda. We have bond ordinance number 3.
Bond ordinance providing for various pedestrian traffic signal improvements by and in the County of Atlantic, State of New Jersey, appropriating $11,615,000, therefore, and authorizing the issuance of $11,061,904 bonds or notes to finance part of the cost thereof. Final reading.
Motion.
Second.
Motion been made and second. Any freeholder comments? I see none. Are there any comments from the public since this is a final reading?
No comments from the public.
Okay, thank you. Roll call.
Ballas?
Yes.
Bennett?
Yes.
Bertino?
Yes.
Horsey?
Yes.
Days?
Yes.
Fitzpatrick?
Yes.
Gatto?
Yes.
Risley?
Yes.
And Kern.
Yes, motion carries. Ordinance number 11 for the final reading.
An ordinance of the County of Atlantic authorizing acquisition of easements from parcels of property designated as Block 7102, Lot 32, Block 8801, Lot 29, Block 7102, Lot 9, Block 8802, Lots 1 and 2, and Block 7101, Lot 135 on the tax map of Egg Harbor Township for the reconstruction of culvert EH27 and bridge structure EH29 over Lakes Creek, along with related improvements by means of agreements or condemnation pursuant to new NJSA 40A:12-1 and following, and NJSA 20:3-1 and following, amount not to exceed $75,000.
So moved.
Motion.
Motion was made and second. Any freeholder comments? Seeing none. Any comments from the public?
No comments from the public.
Hey, roll call, please.
Ballas?
Yes.
Bennett?
Yes.
Bertino?
Yes.
Horsey?
No.
Days?
Yes.
Fitzpatrick?
Yes.
Gatto?
Yes.
Risley?
Yes.
And Kern.
Yes, motion carries. Resolution, we're now into our grants. Resolution number 594.
Grant acceptance from the New Jersey Juvenile Justice Commission for innovations funding for the Atlantic County Youth Services Commission Juvenile Detention Alternative Initiative, amount not to exceed $120,000.
Motion.
Second.
Motion made and second. Any freeholder comments? Seeing none. Comments from the public?
No comments from the public.
Okay, thank you. Roll call, please.
Ballas?
Yes.
Bennett?
Yes.
Bertino?
Yes.
Horsey?
Yes.
Days?
Yes.
Fitzpatrick?
Yes.
Gatto?
Yes.
Risley? And Kern.
Yes, motion carries. Resolution number 595.
Grant application and acceptance of Inclusive Healthy Communities Program grant funding from the State of New Jersey, Department of Human Services, Division of Disability Services, to be used to promote inclusive practices for individuals with disabilities, amount not to exceed $250,000.
So moved.
Second.
Motion made and second. Any freeholder comments? Seeing none. Any comments from the public?
No comments from the public.
Okay, roll call, please.
Ballas?
Yes.
Bennett?
Yes.
Bertino?
Yes.
Horsey?
Yes.
Days?
Yes.
Fitzpatrick?
Yes.
Gatto?
Yes.
Risley? And Kern.
Yes, motion carries. I'll entertain a motion now to combine and adopt the Chapter 159's resolutions number 596 and 597.
Motion.
Second.
Motion been made second. Any freeholder comments? Any comments from the public?
No comments from the public.
Okay, thank you. Roll call.
Ballas?
Yes.
Bennett?
Yes.
Bertino?
We lose him?
Bertino,
Yes, again.
Horsey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
Yes.
Risley, and Kern.
Yes, motion carries. Resolution 598.
Professional services agreements with various veterinarians and veterinary office for the provision of veterinarian services at the Atlantic County Animal Shelter, amount not to exceed $52,000.
So moved.
Second.
Motion made and second. Any freeholder comments? Seeing none, any comments from the public?
No comments from the public.
Okay, roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Bertino,
Yes.
Horsey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
Yes.
Risley,
Yes.
and Kern.
Yes, motion carries. Resolution 599.
Professional services agreements with various nurses and nurse agencies for the provision of death pronouncements in Atlantic County, amount not to exceed $55,000.
Motion.
Second.
Second.
Motion made and second. Any freeholder comments? Seeing none, any comments from the public?
No comments from the public.
Okay, roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Bertino,
Yes.
Horsey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
Yes.
Risley,
Yes.
and Kern.
Yes, motion carries. Resolution number 600.
Amended professional services agreement with Dixon Associates for design services for the Estelle Manor Park to extend the termination date and add additional design services. Net increase, $7,500.
Motion. Second.
Motion made and second. Any freeholder comments? Seeing
Chair.
none, any comments from? I hear one.
Madam Chair.
Yes, freeholder Corsi.
Oh, through you to Jerry, I missed this one, this 600. So it's a net increase of $7,500. Would that be considered a change order?
No, I think we've asked them to do extra work, and I think Jerry Griffin went over that today with the budget subcommittee. So I can ask Jerry to go ahead one more time and explain that this is additional work that we asked them to do.
But before he does that, Jerry.
Yeah.
Just before he does that, I'm not gonna put it on the meeting. I just want
Yeah.
to, for my edification.
Yeah.
There was a lot going on this morning with the budget meeting.
Okay.
The original agreement was 453.
Yeah.
778, and is a net increase of $7,500. Whether we ask them or not, that would consider still being a change order, right?
Well, I would say it's a change order with the respect that we've asked them to do extra work.
Yes.
Yes, I would say it's a change order.
Jerry,
You got it. Good. Okay.
That was one of them slick ones y'all were putting in.
I was trying to slick you. That's what. No, it's a change order. Yes.
It's a change order. I don't care how you
That's
dress it
right.
up. It's a
Right.
change order. Thank you.
Thank you. Any other freeholder comments? Hey, any comments from the public?
No comments from the public.
Thank you. Roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Bertino,
Yes.
Horsey,
It's gonna hurt me, but yes, Jerry.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
It's for the veterans. Yes.
Risley,
Yes.
and Kern.
Yeah, motion carries.
It's more for the park, but yes.
Resolution 601.
Amended professional services agreement with French and Perello Associates for engineering design services associated with the replacement of Lakes Creek Bridge EH 29 on Bevis Mill Road, EH 26 and EH 27 in Egg Harbor Township to extend the term date only, no additional cost.
Motion.
Second.
Motion made and second. Any freeholder comments? Any comments from the public?
No comments from the public.
Okay, roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Rutino,
Yes.
Corsi,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
Yes.
Risley,
Yes.
and Kern.
Yes, motion carries. Resolution 602.
Amended professional services agreement with WSP USA Incorporated for the provision of preliminary engineering design services in connection with improvements to Lake Lenape Dam to extend the term date only, no additional cost.
Motion.
Second.
Motion been made and second. Any freeholder comments?
Madam Chair,
Yes, Freeholder Corsi.
here we go with this dam. Amy, how's the dam coming along?
The dam continues to be
The
a
dam.
fun topic. It is moving along though, Freeholder. I will say that you continue to have the monthly meetings.
Okay.
And that's been very important to us to continue the dialogue. This is part of having WSP be able to finish some of the design that we need to do in the phase that we're in and get some of the approvals completed for us to be able to move to that next phase. And we did agree that we want to continue the monthly meetings into 2021 as well. And keep that dialogue going.
Thank you. I haven't heard any update on the dams lately, but thanks so much. I know how important that dam is for a lot of people. And at one point, the dam was a hot issue, and then it quieted down. So that's a good report. Thank you so much.
Yeah, no problem.
Freeholders. Any other freeholder comments? Any comments from the public?
No comments from the public.
Okay, roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Rutino,
Yes.
Corsi,
Dam, yes.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
Yes.
Risley,
Yes.
and Kern.
Yes, motion carries. Resolution 604.
603,
3.
603.
yeah. Amended professional services agreements with various consultants pursuant to the 2015 Bridge and Dam Engineering Services Pool to extend the term date only, no additional cost.
Motion.
Second.
I get here a second.
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 Motion made and second. Any freeholder comments?
Madam Chair, just to highlight for the public, we did discuss these three in the meeting this morning as well. These are all really just to kind of finish some punch list items on various former projects that are still kind of lingering out there. That's why you see some of the 2015, 2017, 2019 dates on each item. Just wanted to highlight that for the public's knowledge.
Okay, thank you for that qualification. Any other freeholder comments? Any comments from the public?
No comments from the public.
Okay, roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Rutino,
Yes.
Corsi,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
Yes.
Risley,
Yes.
and Kern.
Yes, motion carries. Resolution 604.
Amended professional services agreements with various consultants under the 2017 Dam and Transportation Infrastructure Pool to extend the term date only, no additional cost.
Motion.
Second.
Motion made second. Any freeholder comments? Seeing none, comments from the public?
No comments from the public.
Okay, thank you. Roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Rutino,
Yes.
Corsi,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
Yes.
Risley,
Yes.
and Kern.
Yes, motion carries. Resolution 605, please.
Amended professional services agreements with various consultants under the 2019 Dam and Transportation Infrastructure Pool to extend the term date only, no additional cost.
Move.
Motion.
Second.
Motion is made second. Any freeholder comments? Seeing none, any comments from the public?
No comments from the public.
Okay, roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Rotino,
Yes.
Horsey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
Yes.
Risley,
Yes.
and Kern.
Yes, motion carries. That brings us to competitive contracts, resolution number 606, please.
Amended competitive contract with Royal Printing Service for the provision of election ballot services for 2020 elections. Net increase $49,075.18.
Motion.
Second.
Motion made second. Any freeholder comments?
Yes, Madam Chair.
Yep, freeholder.
You know, this is a hot topic, and for $49,075.18, would that be any indication that the 500 plus ballots in Egg Harbor Township, Hamilton Township was a problem, so they had to print more ballots? I'm just asking the question. Was that because we printed more ballots because there was names left off?
No, it was the increase in mail-in ballots, the mail-in part of it. And the second piece of it was they had to get additional provisional ballots for anybody who would not vote by mail. So that's what that paid for.
And the letters and brochures that we had to. Oh.
Yeah, correct.
Well, I missed that. What was that, Amy?
We added like promotional brochures that we were prepared to send as part of the executive order, in terms of informing about vote by mail.
Okay, thank you.
Okay, thank you. Any other freeholder comments? Comments from the public?
No comments from the public.
Thank you. Roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Rotino,
Yes.
Horsey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
Yes. Yes.
Risley,
Yes.
and Kern.
Yes, motion carries. Resolution 607, please.
Renew competitive contract with Rehab Professional Services Incorporated for the provision of physical, occupational, and speech therapy services for residents of Meadowview Nursing and Rehabilitation Center to extend the term date. Net increase $231,170.99.
Motion.
Second.
Thank you.
Second.
Motion's been made and second. Any freeholder comments?
Oh, yes.
Freeholder
Madam Chair, through you to Jerry, that's a heck of a net increase, 231. What additional services, I don't have it in front of me, what additional services are they doing for 231,000 plus dollars?
All we're doing is because of the issues with the nursing home, we've extended the contract 6 months.
Okay,
And we're going out to bid, next year. That's it.
okay, thank you.
Thank you. Any other freeholder comments? Being none, any comments from the public?
No comments from the public.
Thank you. Roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Rotino,
Yes.
Horsey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
Yes.
Risley, and Kern.
Yes, motion carries. Now we're into bid contracts, resolution 608.
Bid contract with Chapman Ford Sales Incorporated for preventative maintenance on county-owned vehicles amount not to exceed $41,000.
Motion. Second.
Motion made and second. Any freeholder comments?
Yeah, Madam Chair.
Yes, please, freeholder.
Yeah, I guess through you to Jerry. This is for the oil changes, Jerry?
This is not only oil changes, but yes, it does include oil changes. That's correct. And so the budget subcommittee heard that this has been changed. The amount of miles in order to go do the work has changed, based on the warranties and the type of oil that's being used. So instead of, if you remember, Frank, it used to be 4, 8, and 24, or 4, 12, and 24. And based on, the kind of oil that's being used today in newer cars, they've been able to extend the time period. So it's 5, 15, and 60,000 miles now.
Right, by using the synthetic blend.
Yeah, correct. Yeah.
Thank you.
Thank you, Freeholder. Any other Freeholder questions?
I thought Frank Ballas, Madam Chair, would have remembered this issue a couple of years before the Freeholder Board. That was a big topic. Talked about the oil change in the Chapman Ford. So I figured he had a little relapse and he remembered it.
Thank you, Freeholder. Any other Freeholder comments or questions? Hey, any questions from the public?
No questions from the public.
Thank you. Roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Rutino,
Yes.
Horsey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
Yes.
Risley, and Kern.
Yes, motion carries. Resolution 609, please.
Bid contract with JDJ Pets Incorporated doing business as Pets Plus to furnish and deliver animal food to the Atlantic County Animal Shelter. Amount not to exceed $29,640.
Motion.
Second.
Motion made second. Any Freeholder comments? Seeing none, any comments from the public?
No comments from the public.
Okay, thank you. Roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Rutino,
Yes.
Horsey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
Yes.
Risley,
Yes.
and Kern.
Yes, motion carries. Resolution 610.
Bid contract with Keefe Commissary Network Limited Liability Corporation to provide inmate commissary services for the Atlantic County Justice Facility. Revenue generating.
Motion.
Second.
Motion made second. Any Freeholder comments or questions? Seeing none, any comments from the public?
No comments from the public.
Okay, thank you. Roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Bertino,
Yes.
Horsey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
Yes.
Risley,
Yes.
and Kern.
Yes, motion carries. Resolution 611.
Change order number 1 and final, contract with AE Stone Incorporated, the resurfacing of Pomona Road, sections 5A and 5C in Galloway Township. Net decrease, $50,444.37.
Motion.
Second.
Motion made in second. Any Freeholder comments?
No, I'm proudly to support this one.
That's a comment, by the way.
Just compared it to another one.
Okay, any comments from the public?
No comments from the public.
A roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Bertino,
Yes.
Horsey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
Yes.
Risley,
Yes.
and Kern.
Yes, motion carries. Resolution 612.
Change order number 3, contract with Arawak Paving Company Incorporated for 2019 various mill and overlay projects. Net increase $7,150.
Motion.
Second.
Second.
Motion made in second. Any Freeholder comments? Seeing none, any comments from the public?
No comments from the public.
Okay, roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Rutino,
Yes.
Horsey,
No.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
Yes.
Risley,
Yes.
and Kern.
Yes, motion carries. I want to our miscellaneous resolutions. Resolution number 613.
Lease agreement with the City of Corbin City for a portion of the school building located at 116 and 132 Carl Road for the operation of K-9 training. Amount not to exceed $60,000.
So moved.
Second.
Motion made second. Any Freeholder comments? Seeing none, any comments from the public?
No comments from the public.
Thank you. Roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Bertino,
Yes.
Horsey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
Yes.
Risley,
Yes.
and Kern.
Yes, motion carries. Resolution 614.
Amended contract with Environmental Resolutions Incorporated for the provision of engineering and inspection services for the bicycle infrastructure project in Margate and Ventnor cities to extend the term date only, no additional cost.
Motion.
Second.
Motion made and second. Any freeholder comments?
Madam Chair,
Yes, Freeholder Corsi.
I know I'm a little slow, so I gotta ask this question again. At the last meeting, I thought we did the same thing, no additional cost and extending the term only. Why is it back on here again?
That's because the project, it was, in order to get the project done, we extended it till the end of the year. And so the project will not be fully done by the end of the year. And so we now got to extend it. We're extending it another year just to make sure that, we are able to, they're the inspection team. So the construction goes on, the construction will pass over this, the end of 2020. And so you still have to have the inspection done. And so we've extended it again to, 2021.
Madam Chair, if I may, Chair, what seems to be the frequency in terms of the holdup for all these extending the dates? Because as we all know, this has been an issue for a long time. The first company got bumped out of whatever case.
Right.
Now we're back here again. What seems to be the delay?
Well, John, let me say this to you. John is on, and John could probably give you more of the delays than I could, the explanations. John, you there?
I don't want to delay the meeting because I don't have.
That's right. Well, that's fine. John won't delay the meeting. He'll give you a quick down and dirty answer.
I don't have a problem delaying the meeting because I don't have anything else to do.
Okay.
Tonight. I'll take the short version of it.
Okay, there's John.
Short version, Freeholder, is that with the federal requirements, there have been multiple hurdles. Finally, the contract was awarded to the new company for the construction. We had originally awarded the inspection contract to ERI before we awarded the construction contract. So that contract ran out. We extended it to the end of the year. And just as Jerry said, now the actual construction is going to start, and they're going to inspect the actual construction. It's all contemplated to be completed prior to Memorial Day of this year, the actual construction, and they're doing the inspection. That's the long and short of it.
So the really short answer is the federal government has made it extremely difficult to install a freaking bike rack.
Yes.
Okay, because that's okay. We're gonna leave it at that.
Okay. Thank you, John. Do we have any other freeholder questions or comments? Seeing none, any comments from the public?
No comments from the public.
Okay, thank you. Roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Bertino,
Yes.
Horsey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
Yes.
Risley,
Yes.
I'm counting numbers.
and Kern.
Yes, motion carries. Resolution 615.
Extraordinary unspecifiable services contract with TAG Consulting Group Corporation to establish an indirect cost allocation plan, amount not to exceed $9,000. I'm sorry. I skipped 615. I'm sorry. Emergency contract with various vendors for deep sanitizing of county buildings due to COVID-19, amount not to exceed $85,000.
Motion with that erroneous line stricken from the resolution.
Second.
Motion been made and second. Any freeholder comments?
Madam Chair, again, through to you to Jerry, for this $85,000, how long is this contract for with the deep steam cleaning of the county buildings? Let me be very clear to my colleagues. I do not have my backup information with me right now, and that's why I'm asking the question, because I know some of y'all, by the looks on your face, want to know why I haven't looked at the backup. Get over it. I don't have it written.
The contract ends at the end of the year, so 12/31. So I think we have 6 or 7 buildings that will be cleaned during this time period, so.
Thank you.
Okay, now I have another question.
Okay, Freeholder.
Yeah.
Okay, so the 6 buildings are for the $85,000, and we said that we would be doing this on a monthly basis now. So that's going to be $85,000 a month?
I would say roughly about that amount, correct? Yeah.
Is that CARES money?
Well, that's something we have to discuss at budget time. That's what I was telling you. That'll be a new budget year, so we're going to have to figure out how to get that done within our budget, because as of right now, all the CARES money that we have has to be spent. Well, I want to be clear on this. Technically, all of the expenditures have to be in by December the 10th for CARES money. We are allowed to encumber before December 31st, and we are allowed on this 1.9 million that you voted on, I believe, or will vote on, can go as late as March. But there has been no promise of any CARES funding after January 1. And you probably listened to the same thing that I listened to, and that is that the states are all hoping that there is another federal CARES type program. Again, whether that happens or not, we don't know. But we'll have to, in some way, make sure that we budget for cleaning of buildings. I'm talking about the heavy cleaning, because we have a regular contract for daily cleaning.
Right, I understand. Thank you, Jerry.
Okay.
It's interesting, Jerry, because the city of Atlantic City, we just hired an outside company to do deep cleaning as well, even though we have a public works crew, and we're allowed to use the CARE Act money. As you indicated, some of that has to be earmarked and spent by December the 10th. And again, there's some other stuff that goes along with it, but it's amazing how there's a short deadline on how you have to spend this money. So everybody's rushing to spend it so they don't lose it. So it's worthwhile spending. It's federal money, and it's being used for the right reason. I was just curious to find out, here we are in December, how long this was going to last, the 85,000, but you answered it.
Thank you, Freeholder. Do we have any other Freeholder questions or comments?
Madam Chair?
Yes, please, Freeholder. Al.
Yes, to Jerry. We're looking at possibly up to $85,000 per month with this no real end in sight. Is this something where we can buy the equipment and do this in-house as we move into next year?
I got to be very honest with you. I'm not sure, because we haven't got, I want to be real clear on this. We haven't gone through the entire budget yet. So we're not, for me to address this now would be real difficult. I'm not sure. Just so you know, the company that cleans for us has done heavy cleanings. And so the question would be, is there a way to amend their contract, a change order, to determine whether or not they are capable of doing this? And it may be less money, but that's something that we're going to have to discuss when we get to the budget piece of that. So,
right. I mean, it's something that needs to be done, but at 85 or even a little bit less than that a month, that's not really sustainable.
Yeah, it's a lot of money. It certainly is.
Exactly.
But
it's a need. It needs to be done.
Right, correct. Yeah.
If I may, Madam Chair, just to follow up on Vallis's question. For example, we, the city of Atlantic City, and Jerry, I know the Board of Education has it, the city has, we also have those spray guns that they go in and spray the offices as well with the chemicals. I don't know if the county has any of those with their employees doing it, but we have it. But we chose to go out to a private company because some of our employees and departments thought it was not being done good enough. So we tried this outside company. And like I said, they started the other day. So time will tell. I don't know if the county does any of it at all. Jerry's frozen.
Yeah, well, sorry, because I should have, Diana's working with, she's just poking her head in the office here. So what Diana's telling me, it's not anywhere. I haven't seen it. So she's in there explaining to me that the 85,000 really is for 2 months. I haven't seen it. They're working, just so you know, they're working on she's just telling me now. They're working on with facilities. They're working on a spreadsheet to see how many of the buildings we could do. So it's more buildings than I thought it was. The last thing I saw where there was 6 cleanings. So I want to, over here correcting me. So I want to make sure you understand. So they'll work on, I'll give you a copy of what the $85,000 will clean when I get it. And you'll also see that it covers more time period than 1 month. Okay. So I'm not privy to that yet and whatever. So good question. Did that answer Freeholder?
Yeah,
Yep.
yes, I'm good.
Okay, right. Okay, right. Okay.
Okay, do I have any other freeholder comments or questions at this time? Okay, none. Any comments from the public?
No comments from the public.
A roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Bertino,
Yes.
Horsey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes,
Gatto,
Yes.
Risley, and Kern.
Yes, motion carries. Resolution 616, please.
Extraordinary unspecifiable services contract with TAG Consulting Group Corporation to establish an indirect cost allocation plan amount not to exceed $9,000.
Motion.
second,
Motion made second. Any freeholder comments? Seeing none. Any comments from the public?
No comments from the public.
Okay, thank you. Roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Bertino,
Yes.
Horsey,
Yes.
Days,
Yes.
Fitzpatrick,
yes,
Gatto,
Yes.
Risley,
Yes.
and Kern.
Yes, motion carries. Resolution 617.
Memorandum of Understanding concerning acquisition of Block 551, Lot 1.02, and Block 864, Lot 15, Holly Street, Hamilton Township, for open space preservation and grassland litigation purposes. Amount not to exceed $1,800,000.
Motion.
second,
Motion made second. Any freeholder comments?
Madam Chair, just a reminder for the public's benefit that this is part of our aviation industry work that we're doing with the ACEA. And we're acquiring this to free up some land by the airport as part of our overall aviation strategy.
Thank you, freeholder. Have any other freeholder comments or questions?
Madam Chair, if I may, through you to Freeholder Gatto, if you can, explain to me where exactly in proximity this property is located to the building we just built, because there's a number of spots out there that's already cut out with trees, et cetera. So are we going into a different area?
This doesn't have anything to do with the aviation building you're talking about. The
building we built. Yes.
Yeah, it's not near that.
That's what I'm asking. We're in proximity where this big.
Well, why don't we ask Jerry?
All right.
So, I mean, the on the airport land itself is, you know, a bird sanctuary, for lack of a better word. It's on the airport. The piece of property that we're purchasing, you know, we have several people that'll talk about it. I mean, Amy knows exactly where it is. It's right near the expressway. Why don't you go through, Amy, and explain where the property is, and where we're really it's a diversion project. So.
Yeah, we're actually shifting the habitat away from onto this comparable type of property in Hamilton Township, right off the expressway. And 50 in Mays Landing, near the Laureldale Fire, kind of back in that area. We're going to shift the wildlife there so that we then free up the property near the airport to be able to continue with the plans that we have.
So I'm clear. I can't, who is the owner of this property? Is it Hamilton Township?
No, it was a, sorry, Jerry.
No, I was going to say it's a private. Why do we, what we will ask you, I think you're on, right, Renee? You're here?
Yes.
Okay, why don't you go through who the owner of the property is and then the negotiation so that the freeholders fully understand that, okay? You're muted. Renee, you're muted. That's it.
Can you hear me?
Yes.
Okay, sorry. As Freeholder Gatto had explained, the property is located off of the expressway west of Route 50, and it's owned by a private property owner. It's currently managed as a horse farm. So the county entered into an agreement previously with South Jersey Transportation Authority where the county would acquire the property that was needed for the replacement habitat management area. So the county has been in negotiations and we've been successful to acquire this property. It's about 222 acres from the private property owner that will be added to our recreation and open space inventory. And roughly 65 to 75 acres of that property will be managed by South Jersey Transportation Authority as the Grasslands Conservation and Management Area replacement site.
Thank you. Freeholder Corsi, do you have further? You're on mute. You're on mute. Freeholder, you're on mute.
So for $1.8 million, and I believe I heard the young lady correctly, y'all have been negotiating this for some time. And when we talk in terms of adjacent to the expressway, would that be the Hamilton Toll Plaza to the left? I'm just trying to get my bearings. Where's that?
Exit 17.
Exit 17, would it be to the right or to the left of the expressway? At the toll booth. There's two farms out there. That's the reason I'm asking that question.
It's just west of that toll booth.
Excuse me?
It's just west of that toll booth where the Mays Landing exit would be onto Route 50. It's just west of that.
Okay. My final question would be, would that be on the left side of the expressway leaving or the right side?
That would be on the eastbound expressway side.
You're in, okay, because I've been asking questions about that piece of property. Now I've gotten the answer. So I get it now.
Okay.
Thank you.
You're welcome.
Do we have any other freeholder comments or questions? Okay. Seeing none, is there any comments from the public?
No comments from the public.
Okay, roll call, please.
Ballas?
Yes.
Bennett?
Yes.
Bertino?
Yes.
Corsi?
No.
Days?
Yes.
Fitzpatrick?
Yes.
Gatto?
Yes.
Risley?
Yes.
And Kern.
Yes, motion carries. Resolution 618.
Grant application and acceptance from the New Jersey Department of Community Affairs for CDBG CV1 funding and an interlocal services agreement with the Atlantic County Improvement Authority for the administration of the CDBG CV1 grant funds, amount not to exceed $475,972.
Motion. Second.
Motion been made and second. Any freeholder comments? Seeing none, any comments from the public?
No comments from the public.
Okay, roll call, please.
Ballas?
Yes.
Bennett?
Yes.
Bertino?
Yes.
Corsi?
Yes.
Days?
Yes.
Fitzpatrick?
Yes.
Gatto?
Yes.
Risley?
Yes.
And Kern.
Yes, motion carries. Resolution 619, please.
Grant application and acceptance from the New Jersey Department of Community Affairs for the CDBG CV2 funding and an interlocal agreement with the Atlantic County Improvement Authority for for the administration of the CDBG VC1, amount not to exceed $2,108,082.
Motion.
Second.
Motion made and second. Any freeholder comments? Seeing none, any comments from the public?
No comments from the public.
Okay, roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Rotino,
Yes.
Horsey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
Yes.
Risley,
Yes.
and Kern.
Yes, motion carries. Resolution 620.
Reappointment of Jerry DeFiccio, John Peterson, and Richard Van Branken to the Atlantic County Agricultural Development Board for terms that expire on December 1, 2024.
Motion.
Second.
Motion made and second. Any freeholder comments?
Can the clerk say those names real fast?
No. I don't think I pronounced the first gentleman's name correct.
I know I can. I just figured that as you say it fast.
Okay, any other freeholder comments? I just want to thank these gentlemen though, and the people that we put on these boards. They do spend a lot of time, for the people, of this county. So I want to thank them. Any comments from the public?
No comments from the public.
Okay, roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Rotino,
Yes.
Horsey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
Yes.
Risley,
Yes.
and Kern.
Yes, motion carries. Resolution 621.
Authorizing consent for a roadway solicitation event by Pleasantville Junior Jokers Football Organization at the intersection of Delilah Road, County Route 646, and Main Street, County Route 585 in the city of Pleasantville on Saturday, December 5, 2020, from 8 a.m. to 3 p.m.
Move.
Motion. Second.
Motion been made and second. Any freeholder comments? Okay, seeing none, any comments from the public?
No comments from the public.
Thank you. Roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Rotino,
Yes.
Horsey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
Yes.
Risley,
Yes.
and Kern.
Yes, motion carries. That brings us resolution 622.
And Chairwoman, we'll need to add 622, 623, and 624 to the agenda.
Okay, do I need to have a motion for that?
Yes, please.
I have a motion to add those.
So moved.
Second.
All in favor?
Aye.
Aye.
Thank you. So they're now added. So we'll go to resolution 622.
Amending resolution number 441, adopted September 29, 2020, a lease agreement with 5218 Property Limited Liability Corporation occupy 11,800 square feet of office space located at 5218 Atlantic Avenue, Mays Landing, New Jersey, for the special needs of the Atlantic County Board of Elections related to the November 3, 2020 general election to extend the term date. Net increase, $8,358.
Motion.
Second.
Motion made and second. Any freeholder comments? Seeing none, any comments from the public?
No comments from the public.
Okay, roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Rutino,
Yes.
Horsey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
Yes.
Risley,
Yes.
and Kern.
Yes, motion carries. Resolution 623, please.
Chapter 159, New Jersey Transit CARES Act Fund, Section 5311, in the amount of $745,187.
Motion.
Motion.
Second.
Motion made and second. Any freeholder comments? Seeing none, any comments from the public?
No comments from the public.
Okay, roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Rutino,
Yes.
Horsey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
Yes.
Risley,
Yes.
and Kern.
Yes, motion carries. Resolution 624.
Grant application and acceptance from the State of New Jersey Department of Community Affairs, Division of Local Government for the Local Government Emergency Fund, amount not to exceed $1,983,853.
Motion.
Second.
Motion made and second. Any freeholder comments? Seeing none, any comments from the public?
No comments for the public.
Okay, roll call, please.
Ballas,
Yes.
Bennett,
Yes.
Latino,
Yes.
Horsey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Gatto,
Yes.
Risley,
Yes.
and Kern.
Yes, motion carries. Okay, that concludes the written portion of our agenda. Any reports of special committees of the board?
Madam Chair?
Freeholder Risley?
Okay, I got one item here. Recently, I attended the South Jersey Transportation Planning Organization meeting, SJTPI. I represent the county there as well. And I'm excited to announce that we're approved a contract with a firm to do a total plan for the Bikeway West project. We have a beautiful bikeway here in Atlantic County. The Bikeway East starts at the Shore Mall and goes to drawing a blank here, to Mays Landing, to ACIT. So where it ends, ACIT. And that's Bikeway East. It was opened in 2003. I was proud to be a part of that. What I would like to see, of course, is the completion of that Bikeway West, which would be about approximately the same number of miles, about 7.5 miles to the Buena Vista campgrounds. So we've awarded this contract to a particular company that's going to do the planning, the impact study, determining ownership of properties, and coming up with a cost analysis. So it's a first initial step in doing something that, quite frankly, I hope I live long enough to see. It's an important project for Atlantic County and something that I truly believe in. So with that, we've taken this first step. Thank you.
Thank you, Freeholder. Yeah, it is a very important project. Do I have any other reports? Okay, seeing none. Any unfinished business? Okay, seeing none. Any new business? Seeing none. We've all received copies of written communication and petitions. Does the freeholder have anything they wanted to share? Freeholder Gatta?
Thanks, Madam Chair. Just two quick things. I received an email from a young lady who's a server in Atlantic City mentioning that something's happening where some restaurants are starting to charge servers for the portion of the credit card fee that is obtained or is fielded by the restaurant right now. I sent this over to Michael Chait at the Atlantic City Chamber and also wanted to see if there was anything happening legislatively in the state to look or discuss this. Once I get some more info, hoping to bring it to maybe one of our subcommittees to take a look at and see if we want to take any action on potentially protecting our servers if indeed this is happening. I need to collect some more information, but more to come on that one. And then the second piece I wanted to mention is I know I'm starting to see an influx again of our constituents asking for some assistance with unemployment as some restrictions are going into place again and some folks are losing their jobs. So I just want to say thank you to our staff who has been assisting us with those and helping to get people working through some of their issues. And so I just want to say thank you to you and your staff, Madam Clerk. for that assistance. Thank you.
Okay, I want to jump in and ask Freeholder Fitzpatrick, because her and I actually had a couple conversations this week regarding the instance with the restaurants. So Freeholder Fitzpatrick, would you like to make some comments in this regard as well?
Sure. I just want to look for the email that I got regarding the charges, the credit card charges that were proposed to be deducted from servers' tips. It's the charges on credit cards when the tip is put on the credit card. And the restaurants are proposing to deduct what I was told was 1.5% of the fee from the server's paychecks. And the last email I got from the server says it looks as though they found something in the law that already exists in New Jersey that will prohibit it, but we're not positive about that. I mean, my nail salon doesn't allow us to put tips on the credit card anymore because they don't want to pay the fee. So that's not something new, but it is new for food servers, and in an economy where that is so dependent on tourism and dining, and we've been hit so hard that we just shouldn't have to take this. And I would hope that we would support our food service industry workers and oppose this if it comes.
Well, Freeholder Fitzpatrick, let's get together and compare notes, and then maybe we can put something up together.
That would be great. Absolutely. Thank you.
Yeah, thank you. And thank you. I know that.
If that don't sound like it's bipartisan, I am totally.
I do know that Freeholder Fitzpatrick, has made some research with this and wanted to bring a resolution to this meeting and wanted to bring it up for conversation, first before we did that, and was looking into it a little bit more. So thank you two for getting together on that. Thank you very much. Okay. Do I have any other new business or any other comments?
I have a receipt. Okay. Yes. Okay. So we all received an email, I believe, and it had included information from the New Jersey DEP that announces new state programs for municipalities and counties to purchase electric vehicles. And I am a proponent of phasing out our gas-powered passenger vehicles that department heads drive. We went through all of this, and I was educated and understand why a lot of our big vehicles can't be electric, and it doesn't work that way. But anyway, the state has now a $4,000 grant for the purchase of up to 2 electric vehicles for local government, and then also has put electric vehicles on the state purchasing contract list. And when we had a demonstration, which Ms. Freeholder Corsi will remember, of electric vehicles over at Bader Field, one of the ones that's on this list is the Chevy Volt. I'm not doing an ad, but I think it's a little SUV, and it could be very practical for the county to use. So I would ask that we consider that again. The state is moving toward no fuel emissions by 2050. That's not as far away as it sounds. And so I think we need to get on board with using alternative fuel vehicles. I just want to bring that forward.
Okay.
Madam Chair, can I ask also?
Freeholder Corsi?
Actually, it's more of a comment to add on to what Freeholder Fitzpatrick just said. I noticed, and this question would be comment would be directed to Jerry. I noticed that at the county building in Northfield, I see 2 brand new gray electric cars. There are no tags on them. They seem to be brand spanking new. Is this something we're just holding on to, or you haven't put them in service yet? But I did notice them sitting outside the building the other day.
Those are 2 buildings we purchased through, NJDEP. We had to go through the BPU, and we got the $4,000 for each one. You got pretty sure you saw that. They're 2 Nissan Leafs, and they will be, they're just waiting to get the license plates and the tags and everything and registrations, and then they'll be assigned to departments.
Very nice.
That's fantastic. Thanks.
Yeah.
I saw them sitting out there. That's the reason I asked that question. I noticed
Yeah.
that they were tags and
Yeah.
they were electric pumps, and I was wondering, are they samples, or are they test driving them, or what are we doing? But you indicated we purchased them already.
Yeah, we went through the program that Freeholder Fitzpatrick just described.
All right.
That's great. Thank you.
Thank you. Thank you. So do we have any other written correspondence or anything else in the freeholders? All right, that brings us now to open the public comments portion. Anyone that would like to speak, please type yes in the question and answer box. You'll be raised up as an attendee to a panelist. When you're raised, please state your name and your where you reside. Do we have anybody from the public?
Yes, we do. We have Mr. Creed Pogue. We'll raise him from a attendee to a panelist. If you just give us a moment. Followed by Mr. John J. Keenan. So we'll first start with Mr. Pogue.
And unmute the speaker.
Okay, Mr. Pogue, you're on.
Thank you.
You're welcome.
Did a quick Googling while Freeholder Fitzpatrick and Freeholder Gatto were talking about it, and apparently, and I've emailed already to the two freeholders the PDF. Apparently, New Jersey Department of Labor, under its tipped work explainer, says that deducting the credit card surcharge is illegal. Now, of course, there's the whole tip credit thing, which is a whole other ballgame. But apparently, deducting the credit card fee over and above what they consider a tip credit for the purpose of minimum wage and all that would be improper. But I did email the PDF to the two of them so they can take a look at that. Thank you.
Thank you, Mr. Pogue. Okay.
Was that a sighting of Creed Pogue, Madam Chair?
I'm back.
Was that a sighting of Creed Pogue?
Yes, it is.
He's back.
Well, Freeholder, I spoke earlier, so.
Yeah. I guess he wasn't. So, Mr. Pogue, do you have anything else?
That was it. Thank you, Madam Chair.
All right. Thank you very much, Mr. Pogue.
And Chairwoman, if you would just give us a moment to return Mr. Pogue to an attendee and raise Mr. Keenan to a panelist.
Okay.
Mr. Keenan, you can speak now.
Thank you.
You're welcome.
I'm wondering if there's been any freeholder committee meetings since November 17th where the topic of ACIT's plan for expansion was discussed, and if the freeholder committees have been discussing what the role of the freeholders would be when there is such an application put forward.
I'm not aware of any meeting that has been, and I'm not sure what your second part of that question is.
I'm wondering if the Atlantic County Board of Chosen Freeholders have been discussing what their role would be in ACIT's plan for expansion.
Okay.
Madam Chair, let me, if I may, I chair that committee, and no, we have not had any meetings. I have not had any conversations with the administration, let alone any conversations with ACIT at this point in time. I'm sure in the new year, this issue will come up and it will be addressed through the committee. We will ask that the administration, through Jerry, through our chairperson, to make sure any information that's out there that we get it in a timely fashion. But I think it's fair to say none of us have had any conversations that I am aware of with ACIT moving forward since early stages when they did an application. And I stand to be corrected by my colleagues if there's been any conversation regarding that.
No, nobody's reported on anything at any meetings that I'm aware of.
Well, thank you. I'm just questioning because any support that the freeholders would give that application would mean a $10 million tax increase for all the residents of Atlantic County just for one high school, and that's increased debt. and I'm wondering when these discussions will begin. 1 year ago this month, the freeholders acted upon ACIT's request to consider and submit an application that was a surprise, that was surprisingly placed on the agenda without any notification from anyone. And I'm just looking to see what the timeline will be when you'll begin these discussions.
Madam Chair, if I can again, once again, I would respectfully disagree with the gentleman. It was not a surprise. We knew it was going to be on the agenda. We discussed it. And again, I think we've had this dialogue back and forth, and as normal, we can agree to disagree. But I think it would be fair to say only person who could apply for it would be a county high school. And I stand to be corrected, and Jerry can correct me if I'm wrong, but I don't think a public school, from what I remember, was eligible to apply. It was for county high schools such as ACIT, but there's been no other action taken that I am aware of. And I said before, we did call a meeting. We talked to county, we talked to superintendents from various school districts. And if you recall, most of them didn't even reply yay or nay. 2 or 3 people had some comments to say, and that was the end of that. But to this day and point, we have had no meetings since we passed that resolution. But again, I like to be corrected through our attorney or through Jerry. Only person who could apply for it at the time was ACIT.
Right, we just need to get the timeline, as you said, Freeholder Corsi, nothing's been brought to us, with the timeline yet, but I'm sure things are, going to be, we'll probably hear something soon in the near future.
Well, thank you. I would like the freeholders to try their best to be open. I've heard several times in every meeting that you like to explain things for the benefit of the public. And I think the public should be included in the timeline when you'll be considering this so that it can be fairly discussed in an open dialogue. Last year in December, not one freeholder knew that a resolution would be placed on the agenda. It came in between meetings. Not one freeholder replied to inquiries. Chairwoman Gatto did not reply to any inquiry about a resolution being placed in the agenda. I'm looking to avoid that this go around and have you keep to your usual practice of being open and having several meetings to discuss something that would include such a large tax increase for the county.
Thank you very much, Mr. Keenan. As you know, we're always very transparent with what we do. And when we have meetings, we report on them at every meeting, and we're always open to the public for their comments.
Thank you.
So thank you. Okay, do I have, is there anybody else from the public?
No, there's no one else, Chairwoman.
Okay, I will entertain a motion to adjourn.
Motion.
Second.
Made and second. All those in favor?
Aye.
Aye.
Thank you
Aye.
very much, everyone. It's been a long night. Thank you very much.